So, good afternoon, everyone. I would start this session with a quote. So, as this is the topic of headache and pain, and concerned with the case which I am going to present, I felt this quote will be suitable. Harder the pain on the one side, make us the smoother on the other side. Let the journey of the life be harder to enjoy the smoother side. So it's a case of 42 years old female with the complaints of headache. And the journey started in this way. So I asked her, tell me all your complaints. Pain in the forehead and back of the head. Observation, her hand gesture is of holding the head, exactly which I showed in the image now. In the similar way, she was pressing her head. Pain is such that I can't even talk to anyone. In the last 2-3 months, during the periods time, especially during the first day and the second day, pain is more. That is, head pain is more. As ma'am just now only said, the same similar symptoms. And the chill food increases the head pain. Whenever there is head pain, I drink hot water to get relief of the pain. We can see the thermal modalities here. Pain is unbearable that I have to keep my hands like this, like pressing as similar in the image. And to press to get relief of the pain. So pressure ameliorates the pain. If I take head bath on that day, there is no pain. But after 2-3 days, head pain begins. Whenever there is a climate change, and if I take head bath, pain will begin. So similar way, these are all the modalities of the headache. So further when asked, she said, I will be thinking when I am going to get relief from this pain. If headache is unbearable, I will go and lie down in silence. I will not do any work. How much soever work may be, if I go and sleep, headache will be better. I will never take medicine of any sort. I will just sleep in silence. If I sleep and wake up, pain will be reduced. Only that is the solution. Nothing else I will do. So whenever headache is there, she wants to take rest. She wants to lie down. She wants to sleep. So that she will get relief from the headache. And whenever she wakes up from sleep, her headache will be reduced and no other treatment she needs for this headache. 2 days before, pain was unbearable in the back side of the head and inside eyes. I can't bend down or bend up. As I took head bath 2 days prior to that day, I went to shop to home and I lied down in silence. Next day morning when I woke up, I got relief of the pain. And the next is, if I get tensed, angry or do things in hurry, pain will increase. If I do my works in silence, there won't be any problem. Whenever there may be the pain, I will go and take rest. So whenever she gets anger or tensed, headache will be increased. I want to get relief of this pain. I don't have any other tension. Due to pain, I will get angry. Even without my knowledge, even unknowingly, without her knowledge, she gets pain whenever she is in anger. During the pain, she gets anger. I can't do any work. As it was hot climate since 4 months, there was no problem. When I ate chill food, but when climate changed, I don't eat chill foods as headache arises. Day before headache, it's heavy now. It's not like that. If it pains, it will be like pinching type of pain, and pain is unbearable. If someone talks during the headache, I will get anger. I can't bend down and don't know where it is. Paining in the whole head will be paining. So whatever she said is, no one should disturb her during the headache. Even if someone comes and talk to her, even that increases the pain. Just she wants to lie down during the headache. Even the simplest disturbance of talking of the others also causes her the headache. If someone talks at the time of headache, I can't speak. I will get angry due to unbearable pain. I am unable to do anything. Due to headache without any tension, I want to take rest and nothing else I will do. So I asked her, what's the tension? Tension in the sense, my son does naughtiness, so I will get angry. I will tell him, if you do naughtiness like this, I will get angry and I will get headache. I will cry due to unbearable pain. Even if others talks at the time of headache, I will get angry. So I will go and take rest due to unbearable pain. I won't be able to talk. I might use hard words on others at that time. So I will get angry. So her concern is she uses hard words on others. So she won't talk at the time of headache. And she will get angry also at the time of headache. If I tell children, don't disturb, they will understand. If I tell husband, he will tell you don't do anything, go and take rest. He knows if I sleep, I will be fine. She said whenever there is a headache, if she tells her children or husband, they will understand that she's having headache and she wants to take rest. So they themselves will tell, go and take rest. And then when she takes rest, I will be fine. Then further when she said, I am very sensitive type. If someone speaks harsh, it hurts. I won't speak loudly. I'm a calm type. During property loss, I was so vexed. Even in the property loss, what was her concern is when others talks about her, that hurts. If others talks about the property loss, it hurts her. In childhood, everyone will tell, I'm so silent. They will ask me, how can you be this much silent? When I am in silent, I feel peaceful, relaxed, and no pain. So in this whole case, we can see like exact modality she had given, and whenever there is a slightest disturbance or when others talks, headache is increasing. In her emotional level, she is very sensitive type. Others, when she uses harsh words, it hurts her. Then we can see like property loss. That also when others talks about her, it hurts. And she detailedly explained how the pain is and when it will be increased, when it will be reduced exactly. So I took these rubrics. Head pain menses during, head pain pressure, external amelioration, head pain chill during, head pain heat ameliorates, head pain bathing after, head pain bending forward. So with these rubrics, these are all the remedies which covered. So what I did is, as we all know, she is sensitive and with others what she hurts her, and she cannot use harsh words on others, and whatever there is in the surrounding, it's disturbing her. Like if Shan does naughtiness, it brings her anger. If others talks at the time of headache, it brings her anger. So she is sensitive to the surroundings. So I went into the plant family and I went into VIOLALES, which I will explain the following reason why I entered into VIOLALES in the further slides. So when in VIOLALES, bryonia is the main remedy which covered all her symptoms. So let us see what is the Materia medica. Exceedingly irritable, everything puts him out of humor. Delirium, wants to go home, talks of business. Bursting, splitting headache, as if it would pressed out, as if hit by a hammer from within. Worse from motion and stooping. headache became seated in the occipit. Headache worse on motion, even of the eyes, frontal headache, frontal sinus involved. So it's a VIOLALES family. And the main sensation of the VIOLALES is vexation, chagrin, disturbed. Then all the type of physical pain like cutting, stabbing, lancinating, sharp, stitching, pinching. Active reaction is irritable when questioned. Violence, malleolence, rage, restless. Passive reaction is irritable when questioned. Morse, aversion to be disturbed. Averse to be disturbed. Wants total rest, avoidance of people. Quiet, calm, and stillness. So in the whole case, we can see like with the single modality, all covering all through. Whenever there is a slightest disturbance or anything, she gets the headache. And whenever she take rest, complete rest, headache decreases. And what she said, I don't want to talk to any people during the time of headache. We can see like avoidance of the people, which is covered in the passive reaction of VIOLALES. And the headache she described is at the physical level. Or detailedly, she had described the headache, how it is. And she wants to be in the quiet, calm, and stillness. She wants to be in the silence when headache is there. So with these issues, I went into VIOLALES family and I gave her Bryonia. And Bryonia 200, only one dose I gave her. And in the next 15 days, this was her follow-up.
சைனஸ் பிரச்சனை வந்துச்சுன்னா தலை ரொம்ப வலிக்கும். தலை, மூக்கு, கை, இந்த காதுக்கிட்ட, இங்கே புடனிக்கிட்ட எல்லாமே ரொம்ப வலியாக இருக்குங்க. வேறு எதில் கான்சன்ட்ரேஷனே போகாது, அவ்வளோ வலி இருக்கும். சின்ன சாப்பிட்டாலோ, ஃபேன் காற்றுல போனாலோ, கொஞ்சம் கிளைமேட் மாறினாலோ உடனே தலைவலி வந்துடும். ஃப்ரிட்ஜில் வச்ச எது சாப்பிட்டாலும் அடுத்த செகண்டே பெயின் வந்துடும். இப்போ கொஞ்சம் மருந்து எடுத்த பின்னாடி கொஞ்சம் 2 டைம் லைட்டாக வந்துச்சுங்க. ஆனால் அப்படியே மெதுவாக 1/2 மணி நேரத்தில் அப்படியே கொஞ்சம் டவுன் ஆயிடுச்சு. ஒரு 2 நாளைக்கு இருக்கிற தலைவலி கொஞ்சம் அப்படியே ஒரு 1/2 hour 1 hourலேயே அப்படியே க்யூர் ஆயிடுச்சு.
So I will translate this in English. So what she said is, previously she had headache problem and whatever symptoms she had conveyed, she explained that. And now after 15 days of this medicine, she said previously headache used to be there continuously for 2 days. Now when I took the medicine, now it came in between 2 days it came, but it was there for 1.5 to 2 hours only, not for completely 2 days. And headache has been much reduced now, not like previous. And now she is 70% better than previous when she came. So this was her first follow-up when she came. Then after that, I gave her medicine for another 15 days, and within the 2 months of period, her headache was completely gone, and she is now 100% better. And medicines have also been stopped for her now. So in follow-ups also, she mentioned regarding the climatical change, thermal relationships like cold and hot climate. So this climatical changes and everything we can mainly see, as we all know, we can mainly see in the plant families, sensitivity and everything. So this is my experience in migraine or headache cases, and this is the follow-up details. So thank you all for patiently listening. Thank you so much for this opportunity. Thank you, ma'am. Thank you, sir, for this opportunity. Thank you.
Thank you, Dr. Kirubashini. It was really amazing case and very well taken and very well followed it up. Because in such kind of cases where the episodes are quick in frequency and intense in the intensity, the proper follow-up from the homeopath side has a deep connection with the patient and long-lasting connection. If you take out these patients from this severe pain, they become your lifelong followers. Not only them, their whole family becomes your patient. And that's what is my own experiences. So excellent case, Dr. Kirubashini. And I must say that VIOLALES family or Cucurbitaceae family, where bryonia is one of the remedy, colocynthis is another remedy, then rufa operculata is another remedy. Many such remedies, these remedies are very good in migraine cases if the totality matches. And as Dr. Kirubashini shared, I would just like to add a few points. So basically for VIOLALES patient, this thing is very important. You know, whenever their discomfort starts, especially our today's topic is headache. So invariably they will give this modality that they want quietness, quietude, desire for is the rubric for them. Rest, repose, desire for is the rubric for them. So their complaints, the pain, the intensity of the pain, or any accompanied symptom which comes with the migraine, they reduce considerably when these patients take rest. And what kind of rest it is? What contains in that rest? First and the foremost thing is for them is no disturbance. That means you should not go and talk to them or consult them or ask them something. So any kind of contact is no for them. So they want to be alone during that time. That's the first modality for them. Second is lying down. And maximum, they will also tell you that I take a quick nap and that is a remedy for me. So again, sleeping matters because what we do in sleeping, we are in our own zone. We are not in connection with anybody. So again, no disturbance. So this is their red mark sign. They do not want any kind of disturbance when they are agitated. Another important thing with that rest is they want darkness. It is not only simply sleeping, but they will specifically, most of them will tell you specifically that I would like to off the lights. If that is not possible, I cover my face so that my eyes are off any kind of light. So if you can see retrospectively, they are covering all their sensory organs, their ears. They do not want to hear anything, any sort of noise also, may it be of TV or may it be of somebody conversing or somebody conversing with them. Eyes, they do not want any kind of light, sunlight, normal tube light, nothing. Third thing is also they tell that I also prefer to totally cover my head, or not only cover, I would like to wrap it up with some cloth or something. This is third important thing for them. Pressure, and what kind of pressure? The sub-rubric is there. Hard pressure ameliorates. It's not just you tight up, no. You should nicely, tightly squeeze it. That kind of thing ameliorates them. So these are the basic modalities when these kind of patient comes to you. So by chance, if you are getting such kind of patients as acute cases, please don't forget to take these modalities into consideration. These modalities points 99% to these family remedies. So what is the meaning of vex? Now our patient also told that whenever she used to get vexed, the complaints will start. In Hindi, it is called as junjla dena. That means to annoy somebody. That means, you know, to ask somebody something which is not going well with them. And that too repetitively. And that gives them this kind of annoyance. Why? Why are you asking me? Please don't come to me again. It is irritating me. It is giving me anger. So you can see it on their expression, facial expression. You can see it in their body gesture. If I can show it over here. See this kind of thing. Please don't. Now go away. Don't disturb me. Leave me alone. These are the things which are very important. चिढ़ा देना किसी को. To make somebody annoyed. And these are some words that they can use to describe their mental state. Irritation, vexation, displeasure, and in Hindi, चिड़चिड़ाहट. मुझे चिड़ आती है, मुझे बहुत चिड़ आती है इस चीज की. क्यों आते हैं बार बार करने के लिए? Why they are again and again asking me? Can't they understand that I am in trouble? Sometimes even these patients in anger, because of this annoyance, what they feel inside, they actually do it outside. What I mean by this is they feel stabbing kind of a pain, stitching kind of a pain. So when they are too much annoyed, they can even stab somebody because that's what is happening inside them. So you can translate these words in your local language and you can understand what our patients are actually want to convey when they try to convey with their chief complaint, and what exactly affects them to cause these kind of complaints. So many a times these patients who have, to whom we will give violence kind of medicine, they will give you this elements from, weather change, or somebody, I had a dispute with somebody and that annoyed me or that vexed me. And then this kind of headache started with a typical location and typical kind of modalities. So in violence, the modalities are the highlight in the case, because these people, they give, with whatever cases I have seen up till now from the violence family, they give modalities excellently well. So if you come across such kind of patients, please consider these remedies if totality matches.